Senator Elizabeth Warren's recent waffling on Medicare for All presented a hybrid of the concept, allowing consumers to use a public option which is more in line with the moderates of the Democratic Party.
So at first, Warren had said she was all in. She was with Bernie on M4A and wanted a plan that looked just like the senator's been touting for months. Then she said she wanted to reverse President Trump's, quote, efforts to sabotage the Affordable Care Act. Now I'm confused. I spent 5 minutes talking about her change of heart yesterday and a lot of hours thinking about it. So we are seeking some clarity today. Joining us to discuss Senator Warren's recent shift and what Senator Sanders thinks of it is Josh Orton, National Policy Director and Senior Advisor for Bernie Sanders 2020. Great to see you, sir.
Thanks for having me.
All right, so to the extent that you're willing to react to Senator Warren's plan, what is your reaction to her plan?
Well, I would go back to what Bernie said in California last week, which is that he believes that in order to pass Medicare for All, because we want to guarantee health care as a human right, if we are going to pass Medicare for All, it means we're going to be taking on some of the most powerful organizations and institutions in American politics today with their unlimited amounts of money, the pharmaceutical industry, the healthcare industry, and he wants to start that fight right away, right on day one. And I think that, Medicare for All has been the cause of his life, and I think that, this means building a movement. And I think so from the beginning, I think Bernie has always said that this is not going to be easy. And I think that's one of the things that people admire about him is that he knows that this is a big fight, and this is how he's presenting it, and this is how we have to do it.
Yeah, so Josh, let's talk about that. I don't expect you to hit her plan. Let's talk about how you came to the conclusion that you have to do it this way, which I think is what so many of your supporters agree with. So Bernie says he's going to pass that, he's going to introduce the thing the first week in office. What's the plan for getting it through the United States Senate?
Well, I think the plan to get it through the United States Senate starts before the inauguration, right? It starts now. It means that when you see people all over the country who can't afford the deductible to go to a doctor, who can't afford, who when they're having pain and they're thinking about calling 911, are doing an existential calculation in their head about whether they can afford the ambulance, right? And so part of the plan right now is to listen to those stories and hear the commonality between people who are in the position of not having insurance at all, being underinsured, and not being able to pay for their deduction or a copay, even though they have insurance but can't afford it, and hearing what those things look like. And Bernie did, I think it was last month, did a town hall in Iowa on medical debt. And what he heard from people over and over and over again is that when they did choose to seek care, even though they technically couldn't afford it, they came out with tens of thousands, if not more, in medical debt. It goes past due. It ruins people's credits. They're unable to buy a house. All these other things. And so I think part of the way that they pass Medicare for All is we listen to the need for it, to listen to how our system is so dysfunctional and so broken, and start building a movement to create a mandate to actually pass the thing that we have to do.
So to create that mandate, I want to be clear here, the political mechanism for that is to use that movement to crowd, surround, and push any person who would just show skepticism on this. Is that correct? So and I'm not saying skepticism, I'm saying like a Joe Manchin or somebody like that. Bernie said publicly, we're going to go to West Virginia. Now look, there's no guarantee this thing even gets to the House of Representatives as currently. I mean, half these Democrats are very much more on the corporate side. So what's the plan to deal with it? This is going to take legislative maneuvering on an epic scale, and I want to get into that.
Well, I don't know how you define it as legislative maneuvering on an epic scale, but I think that there's a couple points to that. One is I think Bernie's talked about, and we've talked about how there's a lot of ways that we can use reconciliation in order to get this through in terms of defining a vice president who will define what reconciliation can be used for.
Okay.
But the second thing is Bernie's talked about not just being a commander-in-chief, but an organizer-in-chief. And that doesn't just mean as president going and walking the picket lines when teachers strike, which he will. It means going to the places where people are already organizing around Medicare for All. You saw it with his endorsement from the nurses last week, right? So when he says he's going to be organizer-in-chief, that means going to the places and building the movements that exist, growing the movement that we're creating, to create a context where Medicare for All is clearly really the only solution to finally take the greed out of this completely broken, dysfunctional healthcare system.
So one of the critiques that I see in my Twitter feed a lot is that Senator Warren has been more specific about the pay-fors for her version of Medicare for All than Senator Sanders has been. What's your response to that?
Well, I think from the beginning, when Bernie introduced Medicare for All, and as far back as the 2016 campaign, Bernie had put out a plan for funding. And look, this is what became such a hot topic during the debate, which is that, as Bernie says, healthcare isn't free. Right? And so if healthcare isn't free, that means, okay, so who's going to have a stake in this? And obviously part of it is going to be, there's going to be a tax, payroll tax for employers, right, as part of it. And that replaces the employer paid premiums now that exist in the current private healthcare system. And then there's also going to be, look, there's going to be a tax for middle income people, exempting the first $29,000. But overall, Bernie knows that people who live paycheck to paycheck do this math in their head all day. Yeah. And he knows that if you're going to replace this current broken system that spends twice as much as it needs to with a Medicare for All system, yeah, it's gonna cost some money, but overall, the costs will go down for the vast majority of people. Yeah. And look, I think he's been transparent about that, and I think that that's he's been clear that everyone's going to have a stake in Medicare for All, and that helps make it a universal program. But it also means that everybody has a stake.
I'll give you the most credit for that, which is somebody's skeptical of this. There is only one way to pay for it. It's called payroll tax. So there's a reason that payroll taxes pay for every other so-called socialist program here in the United States. It's because they're widely distributed. Why did you come to disregard some of the things that she obviously went for, as in a wealth tax, immigration reform, all these other things? Why was it that you settled upon that payroll tax as the major pay-for your program?
Well, of course, there's other pay-fors besides just payroll tax, right? But I think that one of the things is that we wanted to make sure that this was funded in as progressive a way as possible, right? Mm-hmm. And so a payroll tax means that if it's a percentage on employers, right, it means in a bad year, it means that it's not going to create this system where there's a disincentive to hire employees, or where it disproportionately hurts employers that have high-paid employees, sure, right? And so it means that it doesn't advantage a law firm over a smaller employer. And so I think the goal here was always to fund this in the way that was as progressive as possible.
Yeah, well, and I think it's reflected in the fact, poll after poll shows Senator Sanders most trusted on healthcare because he's been upfront about those things from the beginning. Obviously, there's a debate tomorrow night.
There is a debate tomorrow night.
From the policy, through the policy lens, what are some of the things that you're hoping Senator Sanders has a chance to highlight?
Well, I think that this has been interesting in that there's really quite a bit of policy that's being discussed, and I think obviously healthcare is going to be near or at the top of the list. I also think that one of the things that we're seeing more and more young people engage with, and you saw this with some of the Sunrise movement that he and Representative Ocasio-Cortez talked to in Iowa, is global climate change, and how are we going to actually address this existential crisis? In 2016, Bernie was asked, "What is the biggest threat to national security in the country?" And he said global climate change, and people were skeptical, right? Fast forward 4 years, and we're seeing this. We're seeing, islands start to be submerged in parts of the ocean. We're seeing coastal cities start to go through these calculations of preparedness. We're seeing the military have to take this into account. And so I think that, we see the science, and if we were to believe the scientists that we don't have a lot of time left, we really have to create a comprehensive program to address climate change. So I really hope that climate change is at the top of the list, too.
Well, Josh, thank you so much for joining us.
Always great to have you, Josh.
Thank
you. Next on Rising, in the fight for gender and racial equality, one scholar is arguing that we shouldn't forget the plight of the working class.
Our conversation with Professor Emeritus of Political Science at the University of Pennsylvania, Adolph Reed Jr., about the myth of class reductionism when Rising continues.